you graduate, if that first job doesn't offer coverage, you're going to know that you've got coverage, because as you start your lives and your careers, the last thing you should be worried about is whether you're going to go broke or make your parents broke just because you get sick. So that's the first thing this legislation does. The toughest insurance reforms in history. And by the way, when you talk to Republicans and you say, well, are you against this? A lot of them will say, no, that part's okay. All right, so let's go to the second part. The second thing that would change about the current system is that for the first time, small business owners and people who are being priced out of the insurance market will have the same kind of choice of private health insurance that members of Congress give to themselves. Small business owners and middle-class families, they're going to be able to be part of what's called a big pool of customers that can negotiate with the insurance companies. And that means they can purchase more affordable coverage in a competitive marketplace. So they're not out there on their own just shopping. They're part of millions of people who are shopping together. And if you still can't afford the insurance in this new marketplace, even though it's going to be cheaper than what you can get on your own, and we're going to offer you tax credits to help you afford it. Tax credits that add up to the largest middle-class tax cut for health care in America. Now, these tax credits cost money. Helping folks who can't afford it right now, that does cost some money. It costs about $100 billion per year. But most of the costs, well, here's the reason it's all right. Here's the reason it's all right. It wouldn't be all right if we weren't paying for it. And by the way, that's what a previous Congress did with the prescription drug plan. All they did was they gave the benefits and they didn't pay for it. That's not what we're doing. What we're doing is we're taking money that America's already spending in the healthcare system, but is being spent poorly. That's going to waste and fraud and unwarranted subsidies for the insurance companies. And we're taking that money and making sure those dollars go towards making insurance more affordable. So we're going to eliminate wasteful taxpayer subsidies to insurance companies. We're going to set a new fee on insurance companies that's going to gain millions of new customers. So here's the point. This proposal's paid for. Unlike some of these previous schemes in Washington, we're not taking out the credit card in your name, young people, and charging it to you. We're making sure this thing is paid for. That's the second thing. Now the third thing that this legislation does is it brings down the cost of health care for families and businesses and the federal government. Americans who are buying comparable coverage in the individual market would end up seeing their premiums go down 14 to 20%. Americans who get their insurance through the workplace, cost savings could be as much as $3,000 less per employer than if we do nothing. Now think about that. That's $3,000 your employer doesn't have to pay, which means maybe she can afford to give you a raise. By the way, if you're curious, well, how exactly are we saving these costs? Well, part of it is, again, we're not spending our healthcare money wisely. So, for example, you go to the hospital or you go to a doctor and you may take 5 tests when it turns out if you just took 1 test and you sent an email around with the test results, you wouldn't be paying $500 per test. So we're trying to save money across the system. cost-cutting measures would reduce most people's premiums, and here's the bonus. It brings down our deficit by more than $1 trillion over the next 2 years. Of opponents of this bill saying, well, we can't afford this. We're fiscal conservatives. These are the same guys who passed that prescription drug bill without paying for it, adding over $1 trillion to our deficit. Oh, we can't afford this. But this bill, according to the Congressional Budget Office, which is the referee, the scorekeeper for how much things cost, says will save us $1 trillion. Not only can we afford to do this, we can't afford not to do this. Insurance reforms in history, one of the biggest deficit reduction plans in history, and the opportunity to give millions of people, some of them in your own family, some of the people who are in this auditorium today, an opportunity for the first time in a very long time to get affordable health care. That's it. That's it. That's what the Congress the United States is about to vote on this weekend. Now, it would be nice if we were just kind of examining the substance. We were walking through the details of the plan, what it means for you, but that's not what the cable stations like to talk about. What they like to talk about is the politics of the vote. What does this mean in November? What does it mean to the poll numbers? Is this more of an advantage for Democrats or Republicans? What's it going to mean for Obama? Will his presidency be crippled? Or will he be the comeback kid? That's what they like to talk about. That's what they like to talk about. I understand. And one of the things you realize is basically that a lot of reporting in Washington, it's just like Sports Center. You know, it's considered a sport. And who's up and who's down, and everybody's keeping score, and you got the teams going at it. It's locking soccer robots. Look, let me say this, George Mason. I don't know how this plays politically. Nobody really does. I mean, there's been so much misinformation and so much confusion, and you know, the climate at times during the course of this year has been so toxic, and people are so anxious because the economy has been going through such a tough time. I don't know what's going to happen with politics on this thing. I don't know whether my poll numbers go down, they go up. I don't know what happens in terms of Democrats versus Republicans. But here's what I do know. I do know that this bill, this legislation, is going to be enormously important for America's future. Yes. I do know the impact it has on the millions of Americans who need our help, and the millions more who may not need help right now, but a year from now, or 5 years from now, or 10 years from now, if they have some bad luck, if heaven forbid they get sick, if they've got a pre-existing condition, if their child has a pre-existing condition, if they lose their job, if they want to start a company, I know the impact it'll have on them.